Hi, Ma'am Lynn. Good afternoon. My name is Christine. Christine Maytalang, and today I'm going to do a return demonstration on the proper way of getting a pulse rate. So, as we know, pulse rate is a wave of blood created by the contraction of the left ventricle of the heart. So, it is normally counted beats per minute. Okay. So, there are of course factors affecting the pulse rate, such as age, sex, exercise, fever, if the patient is having a fever, for any types of medication they are taking, if they're having dehydration, the position that they're of course having, and at the same time if they're having stress or any sort of pathological concerns. All of these will have an impact to the result or the pulse rate of the patient. Now we have to consider 9 pulse sites. So number 1 is the temporals. The temporal is normally located on the temporal bone. It's on the head. We also have an apical, which is located on the apex of the heart. We also have brachial, which is located at the inner aspect of the biceps. It's here. Radial, which we normally use, the lateral part of the wrist. We also have the femoral, which is located in the inguinal part of a person. Popliteal, which is located at the back of our knee. And then we also have the posterior tibial. Posterior tibial is normally located in the medial surface of the ankle. And at the same time, we have the dorsalis pedis. And dorsalis pedis is normally, can be seen, okay, on the dorsalis pedis artery, which passes through the bones of the feet. Okay. Now, we also have to make sure that we understand the purpose of getting the pulse rate. Okay. So this will, of course, help us acquire baseline data. Number 2, this will also basically help us determine if the pulse volume is normal and if the rhythm is normal. This will also help us to check or to monitor any changes in the pulse rate or the pulse rate of the patient, or to basically check as the clinical or the overall client's health status. And lastly, this will help us to check if there's any alterations on the pulse rate of the patient. Now for the equipment, we only need, of course, a watch which has a second hand, and at the same time make sure that we have an antiseptic or an alcohol for us to do the hand hygiene later on. Okay, so today what we're going to do is to I'll be performing getting the pulse rate using the radial. Okay, radial pulse. Okay, so the first thing we'll have to do, of course, is to introduce ourselves to the patient. Make sure that we verify the identity based on the agency protocol. We also check, or we also explain for the reason of the procedure. Okay. After that, we perform hand hygiene, and at the same time, we provide privacy. Okay, so let me start. Hi, sir. Good afternoon. My name is Christine. I'll be your student nurse for today. Can I have your name?
My name is Jaden Teston.
Hi, Jaden. How are you?
I feel well.
Okay, wonderful. Can I have your date of birth, please?
My birthday is on December 11, 2010.
Okay, thank you. So by the way, Jaden, today I'll be performing a pulse rate. I'll be getting your pulse rate, and basically this will help us to get baseline data. Okay, and all right. So you just have to sit comfortably. Okay, and then let me just perform a hand hygiene. Okay. And make sure that the door is closed if you're in a room, or if let's say you're just in a cubicle, make sure that that the curtains are moved, or you're covering the patient to provide privacy. Okay, so again, the first thing we'll have to do is to make sure that the patient is sitting comfortably. Okay, and at the same time, since we'll be getting the radial pulse, okay, make sure that the pulse, it's the radial, or the palm should be at least facing downward or inward. Okay, and at the same time, using our finger pads. Okay, the index, and at the same time the middle finger, we palpate for the radial pulse, which is again located at the wrist of the patient. Okay, and at the same time, all you have to do is to count, or to if the patient is having a regular rhythm of the pulse rate, we can just have it counted for 30 seconds and then multiply by 2. But if you notice that the patient is having irregular beats, then you have to make sure that you complete the 60 seconds, or if it's the first time for you to do the pulse rate counting. Okay, and Apart from that, you have to make sure that you don't use your palm. I'm sorry, don't use your thumb, I should say, in getting the pulse rate, because our thumb have its own pulse, and we might think that we are counting the pulse of the patient, but instead we are counting ours. Okay, so again, let's start. So let's use our index and at the same time our middle finger. So I noticed that the patient's pulse rate is, it's regular, okay, and the volume is also normal. I can see it's regular because there's an equal interval between the beats, and at the same time, the volume is also normal because I can hear a moderate pressure, okay, from the pulse of the patient. Now, I actually got a pulse rate of 44, in which I counted for 30 seconds. So if you multiply that into, so that's about 88, which is still in the normal range, okay? Since the normal range for a pulse rate is 60 to 100, okay? So now, after we have taken the pulse rate of the patient, all we have to do is to document our findings. We have to record it. Make sure that we record any pertinent data related to any variations on the pulse of the patient. So that's it in getting the radial pulse. Now let's move on to getting the apical pulse. Okay, so hello there. So now let's move on to getting the apical pulse of course, of our patient. And as we know a while ago, or as discussed a while ago, the apical pulse is normally located in the apex of the heart. So you can have it located on the fifth intercostal space, which is located on the mid-clavicular line. Okay, so the purpose, by the way, of getting the apical pulse is for us to obtain the heart rate, especially for an adult who are having an irregular peripheral pulse. This will also help us, acquire a baseline data that we can use for future measurements. Now, in assessing for, an apical pulse, there are things that we have to consider. Look for the clinical signs of any cardiovascular, alterations, such as, let's say, dyspnea, fatigue, pallor, cyanosis, palpitation, syncope, or any impaired peripheral tissue perfusion. Okay, we also have to check for the factors that may have an impact to the pulse rate of the patient. Okay, so for the implementation, same thing. We make sure that we introduce ourselves, we verify the patient's information, and at the same time, we also explain the procedure. Okay, and at the same time, we also perform hand hygiene and perform hand hygiene and provide privacy, okay, for the patient. Okay, so hi sir, my name is Christine. I'll be your student nurse for today. Can I just have your name, please?
My name is Jaden Kristen.
Thank you for that, Jaden. And by the way, Jaden, can I have your date of birth?
My birthday is on December 11, 2010.
Thank you so much. So by the way, Jaden, today I'll be getting your apical pulse. So your apical pulse is located on your chest. Okay, so later on, I may need to have your shirt, okay, pulled up so that we can get your apical pulse well. Okay, do you have any questions before we proceed? Okay, thank you so much for that. So by the way, before we do the procedure, we have to make sure that the patient is positioned comfortably. Okay, the patient can either be in a supine position, okay, in which his or her head is elevated 30 to 45 degrees, or the patient can also have, can be on a seating position, okay, just like what the patient is doing right now. Now, after the patient is positioned comfortably or sitting comfortably, the next thing we'll have to do is to locate the apical pulse. And again, the apical pulse is normally located in the fifth intercostal space in the mid-clavicular line of the patient. So, sir, angat ko na po. Let's just count. So this is the apical pulse of the patient. Okay, so now we are going to auscultate. Later on, we're going to auscultate the apical pulse of the patient. But before that, before we use the stethoscope, we have to make sure that we disinfect it. Okay, so using an alcohol and of course a cotton ball, we have to make sure that we clean the earpiece. Okay, we clean the earpiece and at the same time, we also clean the diaphragm. Okay. This is the diaphragm. So after we've cleaned the stethoscope, the next we'll have to do is just to, warm the diaphragm a little bit using our palm. Okay. The reason for that is because if we don't warm and just immediately put it on the chest of the patient, it may cause the patient to startle. Okay. So make sure that you have to first warm, because since our diaphragm is metal, so it's cold. After we have warmed the diaphragm, we have to make sure that we position the earpiece towards the ear canal for better hearing. Okay. And then after that, we also have to make sure that we place the diaphragm on the apical pulse of the patient. Okay. So we listen for the S1 and the S2. So by the way, the S1 is the lob, and the S2 is the dog or the dog sound. So the S1 is basically the S1 is the lob sound or the first sound that you can hear, and the S2 is the second or the last sound that you can hear. Okay, now in the apex part of the heart, normally the S1 is more dominant. Okay, or can be heard better. Okay, so let's start. Okay, so now let's go ahead and get or auscultate the apical pulse of the patient. So same thing. If you notice that there's a regular pattern in terms of the heart rate, you can have it counted for 30 seconds. Okay, and then just multiply it by 2. But if it's your first time to get the vital signs or the pulse rate of the patient, make sure you count it for 60 seconds, or if you notice an irregular pattern in terms of the pulse rate. Okay, so let me start. Sir. Alright, so I've counted the patient's apical pulse for 30 seconds, and I actually got 44. Now if we're going to multiply that, that's 88. Okay, so which is still within the normal range. Okay, because as we know, for the pulse rate, the normal range is from 60 to 100. Okay, so now after we've gotten the result, we just have to make sure that we document all of our findings, record any pertinent data related to variations of the pulse. Okay, and if it's necessary for us to make collaborative problem or to make referrals, we can do so. Okay, so yeah, that's it for getting the apical pulse. Thank you so much for watching, and I hope you've learned something. Thank you. Bye.